this video, we will review how to document a progress note. There are a few ways a progress note can be accessed with inside of CareTracker. One way is on the Clinical Today screen using the action arrow here and selecting progress note. That will open up the progress note directly for that particular patient. Another way is if a patient is not on the schedule and not on Clinical Today, they can be looked up under the context here. Selecting them to place them into context, and then selecting the word medical record here on the left-hand side. This will open up to their chart summary, which now you can select the progress note icon. The most recommended way, or the recommended way to access a patient's progress note is if they are listed on Clinical Today and on your schedule for that day is by clicking their name, which will then open up to the chart summary for that particular patient, where now you can access the progress note just by selecting the progress note icon right here on the top off of the clinical tools. This is the most recommended way, for it will keep the appointment tied to the progress note or encounter tied to the billing. That way there is no duplicate or triplicate encounters being created at the time. Now, if a practice has the copy forward feature turned on, when they access that progress note, the copy feature will automatically populate for them. If not, you can select this copy button right here, which will populate that copy forward feature for you, where you now can select which note you'd like to copy from, and also which sections of that note that you'd like to copy from as well. You would just put a check mark into the sections that you want to carry forward from that previous note. Once you've now selected your note in your section, just select the Insert Sections, and it will populate on the left-hand side of the progress note. You'll also notice that my progress note opened up into its own section here, its own tab on my toolbar up here, and that is because underneath the chart summary in the cogwheel, I had selected Open Progress Note in a new tab. Now again, this is based off of user, so who's signed into CareTracker at the time. You can set up your favorites per se, or your defaults by user anytime that you see a cogwheel here. Also on the top hand side of this progress note, you'll notice the patient's demographics. You have the patient's name, their chart number, date of birth, and their gender. I also have the ability to return back to the chart summary if I needed to. If I need to look up something, I could do that. Or if I did not want to leave this particular chart, but I needed to look up something in the patient's record, I can always select Chart Viewer here on the clinical toolbar. This clinical toolbar mirrors the clinical toolbar in the chart summary. When I access the chart summary, you'll see here that it looks exactly the same as the chart summary for that patient. I can access their problem lists. I can access their medications if I needed to, allergies. I can also look at their history. Maybe I wanted to look at their prior vital signs. I could do that as well. Now this chart viewer is active, so if you added something in this chart viewer here, you'll notice that I have the ability to select record vital signs, or I can select that home monitoring if that's turned on for my practice. I could add in another vital sign if I needed to here, because maybe the patient's vital signs are a little high, and it could be because they are nervous about being at their appointment, and now that they've calmed down a little, I want to retake that. So I could add in my vital signs here, and that will show up in the health history panes as well for that patient. Whatever's put in the health history panes for that patient would also show up in this chart summary as well. You'll notice that their demographics is up here on the top as well, mirroring what's in that progress note. Below your return to chart summary, you have a view template. This will always default to your template. That cannot be changed, but underneath that is where you can change your templates. CareTracker has a lot of templates that you can select from. If you save any of those templates as your favorite, you would be able to select them from the drop down in this template section here. You'll notice that mine are all listed here that I have saved as my favorite. To access a template or review different templates that are within inside of CareTracker, you want to select this magnifying glass here. This will open up to the template repository where you can either search by name here if you needed to, or you can click on the plus sign and that will open up to the selection underneath that particular specialty. You'll notice that these templates are based off of different specialties. So each one might have a little more or a little less templates, depending on what that is. You'll also notice that in my database particularly, I have a globe next to some of mine, and I have what they call like a bookcase next to some as well. If there's a globe, that means that they're global. Anybody who's using CareTracker has access to that particular template. If you see this bookcase, that means that this was created within inside of your practice, and this is practice specific template. Not everybody would have access to it, and only the people that are within inside of your practice. Also, one thing to note, the higher the number, so you might have a number and then a version number next to it, the more tabs and more options you have to fill out with inside of that template. We also have SOAP notes. A SOAP note could be just a plain dictation, could be also used as a nurse's note as well too. So within a SOAP note, you don't have that many tabs to select from. And inside those tabs, there might not be very many choices. Like in instance, this SOAP note, you'll notice that has a lot of blank places where you can do free text. So depending on the scope of your practice, depending on how you want to dictate your particular progress note, is depending on which particular template you'd like to select. Now, if this template is something that you like and you want to use going forward, you could also make this a favorite. So that way you're not searching for that particular template each time. To make it a favorite, you want to make sure that you're selecting this little heart sign next to the wording of that template. And that's going to put it onto your favorites list. So that way you'll be able to select it from the drop down here when you want to use it for whichever particular patient you want to use it for. Now, you can also manage your favorites with inside of a progress note as well too. Kind of similar to how you manage your favorites for your medications or your diagnosis, but this has to do with the templates with inside of the progress note. So when this Manage Favorite screen appears, you'll notice that you have a specialty, and you can select from that drop-down the specialty. Now, these specialties will start to generate based on the templates that you save with inside of CareTracker. Because again, when you look at those templates, they're based off of different specialties. So you'll see here I have a family medicine, a general practice, and I also have an internal medicine. Now I can come in and I can move these up and down if I wanted to, how I want them to be viewed in the list. I can also make them a default if I wanted to. So that way it populates every time that I use a progress note. And I also can remove it from this list if need be. I might have saved it in error, or I thought at that time this is what I wanted, but I found something different and I don't want to confuse the two, so I want to remove that from my list. I would just hit this negative sign here. Once you've now finished reviewing your favorites list, you can hit the word close, and now they would be in the order that you want them to be in underneath this list here, or they might not be here because you now removed them. So I'm going to go back into another template. And every time you change templates, you will see, are you sure you want to leave this page? And you want to leave the page in order for it to change. So that is a normal systematic pop-up. Also over here, I have a Save button. This Save button allows me to save as I document the progress note. And it's good to get into the habit of pressing Save after you complete a section with inside of that progress note. And the reason why I say that is CareTracker does automatically save every minute to minute and a half as you're going through, but you never know what's going to happen. You might have like a bad storm in your area and you're prone to having power outages, so there might be a bad storm, you're dictating, and the power might go out. So you want to be able to pick up where you left off. So I always recommend pressing save as you go through each tab within The progress note, that way, if something does happen, you'll be able to pick up right where you left off and you don't have to recreate it from scratch. Also, it could be internet connection. You could be in an area where it's spotty internet because, again, CareTracker is web-based, so anywhere that you have internet, you have access to a web browser, you're able to pull up CareTracker. So you might not be in the office, you might be in a layover on a flight, and you want to be able to do some dictation on your downtime, but you might be using a hotspot. And sometimes that can be spotty. So you want to make sure that you're pressing save as you're documenting that progress note. So that way, again, you can pick up where you left off. Now, the progress note has two sections. They have the narrative side, which is your right-hand side here. And then you have your actual template side where you can place check marks and add information into. And when you save, it automatically comes onto the narrative side here. So you'll see the narrative side, I have my logo for my practice. It has the patient's demographics, their name, date of birth, age, their date of visit. And then below that is all the information that I've either previously copied forward from another note or as I'm adding in to this particular note from my right-hand side. This section here can be searchable. You just need to type in what you're searching for and hit enter, and it will highlight what you're searching for. As you can see here, it highlighted what I was searching there for me. There are different areas where you can click on and it will open up as you just saw. I can expand this area as well too. If I wanted just to see the narrative, I can expand it just by hitting this little double file folder here. I can collapse it again as well. To document your progress note, you can begin on the tabs over here on the right-hand side. You'll see here that this particular template, I'm using the IMOV option 4, volume 15. So it has a lot of different tabs. My chief complaint here, I can mark off why they're here, what their complaint is. Now, in here, you can check off as many checkboxes as you need or that pertain to the patient. Or you might not use this section. You might use this section below where it's a free text. Again, it's up to the scope of the practice. It's up to the choice of the provider and how they want to dictate their progress note. So this patient here is being seen because she has a cough, COPD. If I needed to add additional information, I can select this finding details, which is looks like a piece of paper with an arrow next to it. And it allows me to now drill down further into that particular issue. You'll see here for my COPD, I have finding details. If I click on each one of these, they give me different options that I can select. Depending on how detailed I want to be or need to be, based off the scope of the practice, I can fill out each one of these sections here. Sometimes your finding details might not have any choices. They might just have a comment box where you can free text in any further information that you need. And you'll see throughout CareTracker in the progress note, you might have some free text boxes. You can have some boxes where you enter in a date or a pain score throughout the system. So I want to make sure that I hit save before I go on to my next tab here. I'm going to go into my history tab. You'll notice that my medication list was reviewed, my allergy list was reviewed, and so wasn't my problem list was reviewed. That can be done underneath the health history panes for whoever is rooming the patient for the provider. They can go in and check underneath the health history panes, the medications, to make sure they're not taking anything new in case they've gone to specialists, or if they were on an antibiotic, you can remove that from the medication list, problems list, to make sure that they still have these particular diagnoses, and update their allergies because allergies do change on people, so to make sure that you have the correct allergies listed as well. You'll also notice that you have the ability here to be able to document either by selecting the plus sign, so it clicks everything and then going in and selecting what is negative. Or you can select the negative sign and just coming in and selecting what is positive for the patient's past medical history. And again, some of these might require a date depending on what that particular choice is. You still have your finding details as well in this screen. So you can now drill down even further into that particular topic. And each finding detail will be different. You'll see here, this one for left ventricular is just a comment box. So that way you can type in that comment if you want to be a little bit more detailed. Those are just choices. They don't need to be used, but depending on the scope of your practice and depending on how detailed you want to be, they are options here for you. You also have an area for hospitalizations as well. And then as you go through the history pane, we have our tobacco assessment. This allows the user to select the status of that patient if they are a smoker, non-smoker, and then drill down into that depending on if they are a smoker or not. Some of these here in the history section are used for ECQMs for MIPS program. So if you are participating in the MIPS program, depending on which ECQM you are attesting to, you'll want to make sure that you're filling out the appropriate area with the appropriate information as well. There's also drop downs that you may see. And again, the yes, no boxes, finding details. We also have the advanced care planning. We have the falls prevention, OBGYN history. And again, the OBGYN history you're going to see on male or female. CareTracker does not discriminate between either genders or any gender for that matter. So you might see this OBGYN history on a male chart, which wouldn't pertain to a male, but you also might see it on you'll see it on a female chart as well too. So don't get alarmed if you do see it on a male chart. That's part of that template. We have our depression screening as well, any surgical procedures. And again, you might need to choose depending on what it is, right or left. Our cardiac history, the preventative care. Now, if who's ever rooming the patient is filling in that preventative care underneath the health history pane, such as the last time they had a flu shot, maybe they have a pneumococcal vaccine, last time they had an echocardiogram, last time they've gone for their mammography. If those are filled in for you prior, they will transfer over into the progress note as well. So you can scroll through and just double check. We have our functional assessment. We also have the family history listed here too, so that could also be filled out prior to the progress note being dictated and filled out as well. Moving on to our review of systems, and again, I want to press save for anything that I've done just in the event that something happens to the computer or the internet or power. We have our review of systems here. You'll notice that this is a free text, so you can type this in. If you're using our Dragon software that works with CareTracker, you can dictate this in too. It's up to the practice and how they're going to dictate. We also have the different things, plus or minus, and little additional boxes as well too. Now in these free text boxes that you see here that have the toolbar ribbon here, you're able to enter in what they call quick text. And it's a way to be able to efficiently document without having to retype the same thing over and over and over and over again, especially if it's something that, this is something that you check on a patient each time. So you don't want to have to document this for each single patient because you check the things the same time each time, and it might be one or two things that are different per patient. So to access our quick text, you can select this little quick text icon here. It looks like a little hammer with a arrow pointing up. That's green. And that's going to open up into our quick text dictionary section here. So you'll see here that you have the ability to search quick text. These quick texts that you see here are quick texts that have been created inside of the practice. You also have access to our library as well, just by selecting this load from library section here. This, when you select it, will take a minute or two to pop up, just to warn you, because there's so much information in there, so I'm not going to press on that. But once you do, you can go through each different section and look at the different quick text, and if you like it, you're more than welcome to use it. But in Once you've used it, you can save it to make it part of your library that you see here, so that way you don't have to go through that process each time. So I'm going to go underneath my review of systems here, and I'm just going to select the general I'm going to select the review of systems for normal because it gives us some information. So you'll notice when I put a check mark there, it pulls up all this information here that I want to use. Now, I'm going to select edit because it's going to bring me into the screen of where I can create this particular review of systems. So you'll see here, I have my caption, my autocomplete, which quick text group, which part is this saved to? Is it part of the company? So that way everybody within that company has access to it. I can make it part of just the group, so only members of the group would be able to use it, or I can make it provider specific, so that way just that provider that documents this way is the only one that uses it, would be the only one that sees it as well. I can also save it as a default. So if this is something that I want to appear in this particular section on this template, each time I open it, I can do that as well. So that way I don't have to go through and look for the quick text either. And then I would just come in and make the changes that I need on those different areas there. Now this section below here is just like Word. So I can do Control, C, and I can center it if I wanted to. It's just like a Word ribbon here. And I can free text in here too. So if I wanted to add to this, I can make any changes that I want. Now, when creating this, if I like something and I want to create my own, I can always Control C, close this out and select the Add button here. And then I can do Control V and put that in there. And then I can add what I want to add in here. Whatever information I want in this box here. Caption, I can give it my own name. What do I want to name this? What is my autocomplete abbreviation? Now, autocomplete abbreviation is just that. It's an abbreviation of the caption for you to use to be able to pull this quick text in faster. So I could make it 1 letter. I can make it 2 letters. I can make it 3 letters. I can make it a word. Now, this is case sensitive. So you have to remember if it's uppercase or lowercase or upper and lower and how you want to do this. So I could just do REW. I'm going to leave this a quick text group of review systems. I'm going to leave it as a company. I like this information here, so I'm going to leave that. I added in my 9-point check or 12-point check, whatever it may be. And now I'm going to save. So if I come in here, I will be able to see that underneath my review of systems. Just by putting that check mark, you'll see that I have that 12-point check here. And I could insert this quick text into this particular patient because this is the one that I'm working on to pull that up. Or I can use the abbreviated caption that I created. So you'll notice that I use REW for my caption. Now I'm going to hold down my Control key with my space bar, and that's going to bring in all that information that I just created instead of me having to type this out line by line by line by line. Now, if I set that quick text as a default, it would automatically populate for me here when I opened up this particular template, and I could come in and make any change that I need here. And adding in the information that I needed to. And again, that is a preference per provider, per practice, per scope of the practice as well. Within your quick text, you can also use what they call tab stops. Tab stops are used when you want to make a choice in a sentence. You know, you might be in your assessment and plan, which is this tab here, and you might be typing out your assessment, you know, referring the patient to exercise, diet, or stress management based off of the information that was, you know, provided in their BMI and the vital signs. And so they might need, you know, further help with different things. So you'll see here that I have a tab stop, and this is the tab stop right here. This little like backwards sign with your choices. Now you'll see that I have 3 choices listed here. I have exercise, diet, and stress management. So how tab stops work is that the first choice is number 1, the second choice is number 2, and the third choice would be number 3. So you would put your cursor I'm just clicking off that. You would put your cursor in front of the sentence and hit the word tab, and it will bring you to that tab stop, as we call it. And then you would select, is it going to be 1, 2, or 3? So in this case, maybe it's stress management, so I hit 3. And it will pull in that tab stop for you. So I don't have to write in stress management each time. I don't have to write in exercise each time. I can just select it from my tab stop. And these can be used throughout Care Tracker in the places in your progress note that are free text areas, I should say. You can use them in your quick text as well. So if I go into my quick text and I select add, maybe I want to call this plan. I'm going to call it FOLs for follow-up abbreviation. I'm going to leave this all the way that it is, and I'm going to create my tab stop. So my patients to follow up in, I'm going to do choices of 3 months, 6 months, or 9 months. And you'll see that I am putting commas in between my choices here. And then I will close out my brackets and add in that sign there. And this is all I want to put here. I don't need to add anything else, maybe a period at the end, but that's it. So now I can save this. I'm going to close out of here, and I'm going to type in my abbreviation, hit my control and spacebar, and now brings up my tab stop that I want to use. I'm going to hit the tab button on my keyboard, and I'm going to select 1 for 3 months, 2 for 6 months, or 3 for 9 months. So maybe I want 6 months. I'm going to hit 2. It's going to pull in the 6 months for me. So it makes it a little bit easier, a little bit faster for a provider when they're dictating versus having to type it out each time. It allows them to make choices efficiently within inside of the program. Now, another way that progress notes can be documented, and this is a fairly new feature with inside of Care Tracker, probably about a year old now, is called Quick Note, which is a little bit different than the quick text that we were just reviewing. Quick Note allows the user to be able to fill out a particular tab all at once that they want to see, and then be able to save that and use it for other patients. Now, the thing with a quick note is it's based off a template. So whatever template you have here is the template that you will always see it on, and based off a tab. So if you create a quick note with inside of the Chief Complaint tab for this particular template here, the only place that you're going to see it is in this particular template and this particular tab. Now you'll see here I have a couple of quick notes already set up for my use here based off of this tab in this particular template. So if I want to use it, I just click on it. And it's going to reload the screen for me. Now I selected new patient. So now you'll see here it clicked the new patient for me, ear pain and facial pain, on top of leaving my COPD and cough that I already selected there for me. And they're also highlighted in yellow. And the reason why it does that is because that just shows that it's part of the template that I originally created for that particular quick note. Now I can hit this little backward sign and it will allow me to take that quick note off as well. Now again, to create a quick note, you can do this on a test patient. You could do it as you're documenting too. If this is something that you're going to see, you know, it could be used for like flu season is coming up. You could use it for, you know, what they're here for. They're an established patient and they have, you know, chills, chest pain, a cough. They might have some diarrhea. And this is, you know, signs that they might have, or even a fever. They might have the flu. So I want to, you know, established patient. These are what they're here for. I could say follow-up visit. You know, had chills, headache, dizziness. Last week. And now if I want to save this as my quick text, I would select the plus sign here. And I'm going to give my quick text a name. So in this case here, I'm going to say flu 2020. And I'm going to save. So you'll notice my flu 2020 now is part of my list up here. If I went to history and I go all the way to the top, you'll notice that my flu 2020 is nowhere to be found. Because again, it is based off of template and tab. So if I go back to my clinical today and say I was going to see another patient who had the same exact symptoms, I would click on their name to open up their chart. Come into my progress note. You'll notice that this progress note here is different. My template is different, so it has different choices. Even if I go into my chief complaint here, you notice my flu 2020 is not listed. So again, it has to be the same exact template that you created it on, and the tab as well within inside that template. So I change my template. I'm going to go to my chief complaint. Here's my flu 2020. So you notice I'm in a totally different patient here. So I'm just going to click on my flu 2020, and it's going to put in that information for me for that tab. So my established patient, my fever, chest pain, chills, I have my cough, my diarrhea as well. And again, these are highlighted in yellow because those are the ones that I've selected to be part of that template. So it's just letting me know that this is a template format with inside a care tracker. Now, one thing about the quick note, and I just went back into my original patient, you'll see here, Tina, is that you cannot alter or edit your quick note once you save it. The only thing that you would be able to do is remove it, and then you'd have to create a new quick note. So underneath your cogwheel here, next to that plus sign, it brings up your manage quick notes. If you wanted to remove it, you would just click on the X and it will remove that from your quick note section. So you'll notice that it removes it from this situation right here, from this toolbar. So I can no longer use it. So if I needed to start over again, I would be able to. And again, anything that's added over here, I want to make sure that I save it before I move on to the next section. If your practice does in-house labs, maybe they do a finger stick or they're doing flu swabs, they might be doing an A1C with inside of the practice. Underneath the test tab here, you have the ability to enter in that information here. Flu swab, you'll notice that we have the rapid COVID testing now too, positive or negative. Hemoglobin, you would have to put that in. You also have the finding details as well, so you could be more specific if need be. If you want to review results for that patient that have been entered in underneath the results, you can click on the review results here. And it's going to open up to all of those particular lab results that have come in through the interface from the lab company. You'll see the patient's information here, and these are all the different types of labs that have come in. And you would be able to click on them and be able to review them. Now, keep in mind, this is just resulting with inside of the progress note. It's not resulting the note underneath your results section. You still would have to go in and sign off those results and be able to link them to the original order. This results them inside of the progress note. So you just select which one you want and you press save. And that will bring it in to your narrative on the right-hand side, left-hand side, sorry. And you'll see here the results reviewed. And again, it's just resulting it with inside of the progress note and not actually signing off on that particular result. We also have our quality section here. You'll see here in that quality section it houses our vital signs. If the person who's rooming the patient for you takes the vital signs underneath the health history panes, they will come over into the progress note for you underneath the quality section here. So you'll see that my patient's vitals have come over for me. So now if I needed to, add in, information, BMI is documented outside of the normal parameters, I could select that. I can also do my tobacco assessment here, preventative as well, my plan items, if it's, nutrition or high blood pressure, any additional information as well. You'll see here they're yes or no's. Finding details. And then we have our depression screening tools here on the bottom. We have our PHQ-9, we have our adolescent, we have the postpartum, mini mental status, basic interview for your mental status, which is the BIMS. We also have the who's and the who's for your knee injuries, fall prevention, substance abuse, and the Kansas City cardiomyopathy questionnaire as well too. You also have your letterhead format here. Now, this letterhead format does not have anything to do with a clinical letter that you would send out to a patient. This letterhead format you'll see most likely in all different templates here, and all that is it's the letterhead that's here on your top of your progress note itself. So it would be set up and it could be shared across all your templates that you use as well. So that's all that this letterhead format is here. Now also, depending on how many tabs you have within a template, you're going to see these little small arrows here. And you'll see one right above this big arrow here, which allows me to move this up so I can now focus on different aspects of that template, different tabs, or if I want to move it down, I can use this little arrow up here as well. Now that I've saved my progress note, I can review this if I want to, and again, I can expand this if I wanted to review it, the narrative, just to make sure everything looks good, everything looks right, sounds right, before I sign it off. And then if I want to expand it back or collapse it, I can do that as well, just by that expand collapse. Then now that I finish my progress note, I want to be able to sign my progress note. And you can do that from the screen here. You don't need to leave. You'll see this little pencil here. If I click on that, that allows me to sign the progress note. And it's going to ask me for a PIN, so that way my electronic signature that I've uploaded into the administration option is now going to be placed onto that progress note. So you would enter in the PIN that you created when that electronic signature was inputted. And again, that electronic signature would show up on your progress note, orders, non-controlled substances, and also clinical letters. So I'm going to press OK. I can also set it up where I can print out a summary report right then and there if I wanted to. I'm going to say cancel for the moment. And if I scroll down to the bottom here, you will notice here is my electronic signature. Now, this is actually signed by me because I'm not the provider, so it will dictate, it will show who electronically signed by if it was not the provider. And this is the provider signature here. Because this provider is in my batch, this provider is linked to this particular patient. You'll also notice here on the left-hand side, because my note is signed off, all my areas of where I could select are grayed out because I can no longer change or edit because it's now been signed off. Now, if I needed to add something to this, I might have forgotten something. I wanted to add something before I signed it off. I can always create an addendum, and that's this little icon here. And it'll bring up my addendum box here. So now I can add in my addendum and save. And that will place it at the very bottom of the progress note for me, underneath the signature, telling me the addendum and when it was added by and who added it. If I needed to print out my progress note from here, I could, just by selecting this print button here. I can unsign a note as well too. CareTracker does give you the ability to unsign a progress note. I don't recommend that if you needed to add in something. I do recommend using the addendum. That way it keeps it kind of flowing. But you do have the ability to unsign if you needed to. Now, if you are coding your progress note, if you're a provider who does their own coding, you can do that from within inside the progress note as well too. I can select this E&M here if I want to have a suggestion given to me based off of what I've selected here. And again, these are just recommended suggestions. You don't have to use that code. You can, based off of what you selected here. It will give you a recommended code, and then you could, select it or choose another code. And then we have our visit capture. And that's that last button here on your clinical toolbar. If you click on the visit capture, it's going to close out that progress note for you. And you'll notice it brings me back into the Clinical Today screen as my background. So now here I can select the procedure code that belongs to that particular progress note. And this here, your visit capture, is customizable by practice. This is set up by the practice. This is your electronic encounter form, basically. So you could have an encounter form on paper and mirror it electronically. So now you would select your procedure code. You'd select your diagnosis. The top diagnoses here are the patient's active diagnoses, and then below this is more common diagnoses that the practice would use. And then you have your visit summary. This is where you can either save it, and then it will go into the billing for the billers now to process and send out how they have to, or you can save and send it in a to-do. You can also cancel this if you didn't want to use it, but I'm going to hit save. And when I hit save, it's going to now, on Clinical Today, change Tina Medicine over to a little green stamp with a check mark. Let me know that the visit is complete. And it could take a minute before the system refreshes because, again, the system will refresh every minute, minute and a half. But depending on when you do the action and when the last time it refreshed, it could vary. So you'll see here that the system just refreshed for me. And next to her name is that little green stamp with the check mark. And if I hover over it, it lets me know that it's complete. So now there's a couple of things that I can do since the encounter has been done, the progress note has been done. If I needed to print out a visit summary as they're checking out, I can do so right from the actions here on the Clinical Today, just by selecting Visit Summary, and that will populate the visit summary for that visit. And you'll see here my visit details, treatment, my chart information. And again, this can be customizable underneath the admin options of what you want to see on a visit summary. I'm going to close out of these tabs here and go back into Clinical Today. Now, sometimes you can save a progress note inside of CareTracker without having to sign it off. You can press save and then move on to the next patient, and it would save underneath the progress notes for that patient. In that case, the progress note would now show up on the quick task on Clinical Today underneath the unsigned notes. Now, again, the provider's staff, MAs, nurses who are working with that provider, they would be able to see the provider's quick task based off of who they selected in their batch. So if you click on this unsigned notes here, it's going to open up to all the notes that have not been signed off by that particular provider in your batch. And depending on how many unsigned notes that you have, it could take a minute or two for this to populate for somebody. So it's always good to keep kind of on top of your unsigned notes and get them signed off as soon as possible. So when I open this up, you'll see here it shows me all the different patients. So here's Frank Test. I have a VIP. Frank Test has been used a lot lately. You'll see Sandra over here. So this is a way for a provider to sign off all their encounters all at once. And again, I can do this by unsigned. I can show all. If I'm covering for another provider, I could check off that provider here as well. I could show all providers if I needed to. And in this screen here, if I click on the note, so let me go back to the first page here. If I click on that note here, it's going to populate for me to be able to review it. In this screen here, I can expand or collapse. I can print it out if need be, and I'm able to sign it from here as well too. I could also print out that visit summary if I had that set up. So now this is no longer an unsigned note. It will leave this screen here because it's been signed. So you'll notice it gives me the date, the type, the patient, the description, provider, signer. If there's a co-signer, this would be the signer, and then if it's been co-signed. And then this S is signed and no, the N is no. Underneath my actions, I can edit the note, I can print, or I can see the log. And the log will tell me who's entered in the information, touched the note, whatever it may be. Also from Clinical Today, another place that should be checked along with your unsigned notes is your open encounters. Now, anything that is being done to or for a patient with Inside a Care Tracker is considered an encounter. So it's not just necessarily a progress note or a visit. It's anything. It could be a new RX. It could be a phone call. Those are all considered encounters. Now, based on how your encounters are set up in the administration for the practice, an encounter may require a bill and it might require a signed off note. So if both of those are not complete for a particular progress note or a particular encounter, then they're going to show up underneath your open encounters. And again, this here, depending on how many open encounters a practice may have or that provider may have underneath the quick notes, will depend on how long it takes to open up on the screen. I do have quite a few open encounters because I am in a test facility, and we tend not to close out our encounters because we're training on this facility. So it can take a minute. It could take 2 minutes. It could take 3 minutes if you have thousands. You'll see here I have 1,300 open encounters. So you do want to get into the habit to make sure that you're reviewing the open encounters and the unsigned notes daily. If not daily, every other day, at least once a week, I would recommend, depending on how your practice sees patients. So you'll see here that this Frank Test is the one that I just signed off. The note is complete, but the visit has not been billed yet. So if you don't see a check mark here on this little green stamp, that means that the billing hasn't been completed yet for that, or visit capture. We do use that word kind of interchangeably. Sometimes it'll tell you it's not signed, hasn't been billed, or it doesn't have a note, but it's required because that's how it's set up in the encounters. You could have one where you have the bill and no note because it's required. So it all depends on how that encounter is set up. Now in this screen here, you can view it by missing an unsigned notes or missing an unbilled procedures. Those are the two main ways that you can view this. So depending on how you want to work the list, you can, or you can select it as all. So those are the two things that are associated underneath the quick task to progress notes that should really be looked at daily, if not daily, every other day, but at least once a week if you have a very busy practice and you can't get to it that day. You should make some time to do that with inside of the work week. Now also, in the medical record for a patient, you can view the progress notes on the individual patient basis. Now underneath the quick task, it's for all different patients. It's not just for that one particular patient. On the health history panes, underneath progress notes, you can review all the progress notes for that particular patient that you're in. So you'll see here, when I click on it, it shows me all the progress notes for this particular patient that I have open, not all the progress notes that I have to sign off, just for this particular patient. I can do a time frame of these if I wanted to. If I'm looking for a particular progress note, I can include all of them, the ones that are signed. Maybe I just want to see the ones that are signed. Maybe I'm just focusing on ones that are unsigned because I thought maybe I signed something off, but maybe I didn't for this particular patient. If in your practice is a co-signature that's required, maybe you are the overseeing provider and you have a co-signer, you co-sign for that particular provider because they might be a provider in training, so they require a co-signature. So maybe you need to look at the ones that, the co-signature is required, so that way you can fully sign them off. Also, in this here, you can click on a progress note and you can pin it. So when you pin a progress note, it's going to put a tab here for you to look at. And then you can click on another progress note and you would be able to pin that progress note as well. And it puts up the tab for you here. So now instead of going through the list, you can click back and forth and compare. So that is the pin feature. You have the same exact features that you do with inside the progress note. You can expand this. If it needs to be signed off, you can sign it. If it's been signed off, it'll give you the unsigned option. And again, we don't recommend that, but you do have that ability. You can add an addendum if need be. You can print it out. And again, you can pin it. Providers only, and only providers, have the ability to delete a note. Now, it's not going to delete it from the system. It's actually going to inactivate that note. So that way, if you need to print out the patient's record, it wouldn't be part of the record. But it does not delete it from the system. It just inactivates the note. But they have the ability to select delete note here, and it's only the providers. It's not an override that can be put on anybody else's operators and roles. It comes along with the providers' roles. When you select delete, it's going to ask you for a delete reason. So you would select what it is and then save. And it will inactivate that particular note. You have the ability to show inactivated notes as well too. You'll notice here that this one is inactivated because it's grayed out. I still can look at it. I just wouldn't be able to do anything to that particular inactivated note. I can't sign it. I can't add an addendum. I can't print it. I wouldn't be able to pin or unpin. It's grayed out. It's an inactive note. I still have the capability to view it though, just by clicking on this check mark here. You also have the ability to restore it too as well. So if I go into my inactive note, you'll notice I have a restore note here, which will allow me to restore that. And I would say OK, and it's going to now change it from being inactive to active. Once I do that, it allows me now to sign, add an addendum, print. I can even pin this if I needed to. My options are now reappearing for me. One other place to look inside of a patient's chart, and this is patient specific, is your encounters. Now again, an encounter in CareTracker is anything that's being done to or for a patient. So it's not necessarily a progress note. It could be a phone call. It could be a new refill. It could be a lab order. So it's anything that's being done to a patient. And again, this mirrors the same that you saw underneath the quick tasks, but the difference is this is just for this patient that's listed here because we're inside of the patient's medical record. We're not underneath the quick task, which would show you every patient that requires a note in a bill. So you'll notice here for this particular date, 10/26, my type is the MRI, my provider, description, my note has been completed and so hasn't my visit. So it's going to show me both because I have all. So if I'm looking for just unsigned notes, I can change it here and it will show me all my unsigned notes, tell me they're not signed. Maybe I'm missing unbilled procedures for this particular patient. I can now go in and see which ones need to be billed out. And this is based off of the patient's chart, off of the patient and not off of the patient as a whole, whereas underneath your quick tasks, this would be the whole practice. Every patient that's linked to that particular provider, whether it be a progress note or something that needs to be signed, or a note has to be created depending on how that encounter has been set up. You can also select this task tab here on Clinical Today if you want to see the practice as a whole. Warning with the task tab here, it could take a few minutes to generate because it's taking all of these quick tasks that you have over here on the right hand side and opening them all up at once. So it could take a few minutes, could take a few seconds, depending on how much information is stored underneath that particular provider. In this task tabs, you'll see that it's kind of broken out, very similar to the quick tasks. Gives you the unsigned notes. It will give you your open encounters. You can also select if you're covering for another provider, that other provider's name here on top of the provider that's in your batch. You can also do a time frame like the last 60 days, last 30 days. I recommend, again, staying on top of this and reviewing at least once a day, every other day, at least once a week, because as this grows, time passes, and it can actually slow down your care tracker system as well too. You could also do a custom period date range as well, and then you would hit search, and that would pull up everything within inside of that time frame. If you have any further questions, please feel free to reach out to your support entity, and they'd be more than willing to assist you. Thank you.